Hi guys, today we're going to go over how to prepare your next vial of testosterone cypionate. So what we're going to do is get a 10ml sterile vial, 4 ampules of testosterone cypionate, a 10ml luer lock syringe, a blunt filter needle and a 23 gauge needle. Prepare a nice clean sterile area, wash your hands and let's get cracking. So the first thing we need to do is actually remove the remaining volume of SIP from the top of the ampule. Now there are 2 ways of doing this. There's gently tilt it. I'll just give it a little double tap. Now one thing obviously is physics. To decrease surface tension, warmth helps. Okay, so if it is cold and it's winter time, just hold it in your hand for a minute or so and it will ease the process. So how do you open an ampule? Thumb, index finger, I'm holding the body, I'm not grabbing it tight. What I'm going to do is I'm just going to pivot like that. Remove your sharps, thumb, index finger, pivot. Thumb, index finger, pivot. Thumb, index finger, pivot. Now I have done this thousands of times. So hopefully there's no glass in there, but as a precautionary measure, we're going to use a blunt filter needle to make sure that when we draw up the testosterone from the ampule, there is no glass, because we don't want to inject glass. Take your 10ml syringe. Open it up, take your filter needle, screw it on, doesn't have to be tight. So take the sheath off, push up, and take your first ampule. So the beauty about cypionate is it's fluid, so it is perfect for subcutaneous injections. The downside about cypionate is it's quite fragile. So you do have to be quite careful when you're preparing your vial. So everything is done very slowly, very methodically. So I'm just gently pulling up. So what I'm trying to do is not disturb it too much. So as soon as I start to see that coming towards the end, you often see a few little bubbles, tiny little bubbles come up. Take your next one. And then repeat the process. So it's just firm pressure. Obviously, going through the filter needle, it does take a little bit of pressure, but it is actually really fluid compared to the other esters. And we use olive oil. I don't prepare the testosterone, but this is what the manufacturer uses. So again, as it's coming towards the end, a little tiny little bubbles, so I stop. So I have been through 6 testosterone cypionate vials. Only 1 crystallized, and the reason why it crystallized because I messed up preparation. The needle slipped out, so it has never happened to me when I prepared it properly. Again, the big thing is not to inject air in there. So if you look at the other video where I go through how to withdraw the testosterone from the vial, you will notice that I fully depress the plunger on the syringe to make sure that when I insert it into the vial, I am not injecting air. If it does crystallize, what you've got to do is just heat it up. So for my last one, I boiled a kettle and put it into a bowl, left it for a couple of minutes, gave it a shake, left it for a couple of minutes, gave it a shake, and it was fully dissolved. It must be fully dissolved. Otherwise, obviously, those crystals are the testosterone crystals, so you're not going to have the correct dose because the concentration is going to be incorrect. I'm going to take the blunt syringe off. Honestly, I do this all day, every day. It's different in front of a camera. So I'm going to change the blunt filter needle for a 23 gauge needle. So, as you can see, we've got hardly any air in there. But what I'm going to do is, just to make sure there's no air going into the vial, I'm going to hold the syringe up and then just gently push on the plunger until I see a little bubble there. So, flip the cap off. There's a central ring, 90 degrees into that ring, and then press on the plunger. So, these vials are full of nitrogen, so that is inert. Now obviously nitrogen has pressure, so after about 5 mil, I feel some firm pressure. So what you're going to notice is a couple of little bubbles come back up. 1, 2. Right on cue. So what I'm going to do is actually release a little bit of the nitrogen. So 4 ampules actually is 9 mil, because they do tend to overfill ampules. So they're 2 mil ampules, 4 ampules works out at 9 mil. One thing a lot of guys do wrong is they hold the vial and they're pushing in, and what they're doing is they're distorting that angle. That's the one thing that we don't want to do, because again, we don't want there to be air in there. So it's a bit firm again. So I'm going to take a little bit more nitrogen out to rebalance it. And then so all of this testosterone cypionate is now in the ampule, in the vial, sorry. So I'm just going to pull back up to 9. So I've equalised the pressure before I take the needle out. So you've now got a fully prepared testosterone cypionate vial. Job done.